we're going to be talking about ability and disability and difficulties and how we manage life. So I've got an awesome special guest here with me today. He's going to help me talk about this. I'm going to share my heart as well and things that I find difficult. And I hope this conversation today really enthuses people, blesses you, helps families get stronger. That's what I hope. Yes, Kay. So maybe I'll let you say this. How do we stumble upon each other?
We met at church.
We did.
So I volunteer with the children.
Yes,
and
you do.
I am in the 2-year-old room. So
Yeah.
I am currently looking after your 2-year-old.
You do?
And we just got chatting one day, which I think is was definitely a God-led conversation.
I agree.
And it's led us to here, really, which I really feel like it was a God-led conversation.
Yeah, me too.
But that's how we met. So I currently lead the 2-year-old room at 2 of our services on a Sunday morning.
On a Sunday morning, and you look after my 2-year-old. I mean, that's what I know. You literally keep my 2-year-old safe, and I appreciate that from you. And one thing I've learned with this whole transition of like learning how to be part of a family, learning about the pregnancy process, I realized that children are actually much more than just the parents looking after them. I know it's like an old school term, but it's true. It takes a village to raise a child.
Yeah.
Like, I realized that you're my 2-year-old's like pseudo mum.
Yeah.
In times, and like, she needs different influences, obviously safe ones, to ensure that she can be the best version she can be. So I appreciate you for that. If you've not been told, I hope you have been told, but I do appreciate you for that.
It's awesome.
Good. So I think that's the introduction. I mean, you've told them how we met. So if you guys don't know me already, I'll introduce myself again. I'm Chris. I'm the founding father of 40 Weeks for Men. It's all the podcast resource made for people to enthuse families to be better at living this life together, despite having children, in spite of having children, because of having children. So we know that family life can be arduous, to say the least, and we're just trying to make it better for everyone in all aspects, and to bring voice to what happens to dads when they have pregnant partners. That's why the 40 Weeks Men podcast was started, but the whole point of it is to improve family life. Speaking of family life, I wanted to say, and I don't know if I've said this, but I truly believe that you are part of our family. I know it's slightly different in the sense that, I'm not making you a hot chocolate in the morning. I don't do that for you. However, my baby does spend a lot of time with you on a Sunday.
Yeah.
Allowing my wife and I to actually go into the main service and actually enjoy church for once. So I see you as part of my family, and I appreciate you for all you do.
Yeah.
I do. So, now the pleasantries are done, let's get into the conversation. So, the first question, what do you know personally about living a life with a physical disability?
I'm happy to go first. So I grew up a relatively normal life. My mum took me to the doctor when I was younger, because I had some issues with my bowel and my bladder. My kidneys weren't working, but the doctors that I was seen by thought that I had some anxiety issues. I maybe was soiling myself on purpose for some, attention. And it we kind of just accepted that. And then when I was 10, I was seen by a really new doctor, and we moved to the south of England, and he said, I think you have nerve damage. I think you need to go to hospital straight away. And I was like, what do you mean? I've just come to see you because I run like a penguin.
Yeah.
You know, some children at school had laughed at me and I'd said, oh, can you help me not run like a penguin? And it turns out that I actually had Cauda equina syndrome.
Oh.
And I needed emergency surgery.
For the people, Cauda equina syndrome is just an issue with your back and that stops your nerves from working well.
Yeah. So it causes all your nerves at the bottom of your spine to be sort of compressed. So it means that all of those organs that are affected by those nerves around your spine are then affected. So your bowel, your bladder, even my walking was affected. My muscle tone was really affected. So I had this emergency surgery up at Great Ormond Street. And when I had this surgery, they sort of said to me, you know,
Ormond Street, gosh,
Great Ormond Street in London, yeah. And so I had this emergency surgery, and they said to me at the time, I was 9, I turned 10 when I was in hospital, and they said, oh, we've damaged the bottom of your spinal cord, and you're not going to be able to walk again.
Oh dear.
And so that's my sort of experience with physical disability in terms of where it started really. And I'm, for anybody who can't see me and who's just listening at the moment, I am walking now. So they weren't quite correct in their, it's a miracle that I can walk now. I had a lovely lady who, a lovely nurse at Great Ormond Street who said to me, I'm going to sound really crazy, but am I able to pray with you? And I said, yes, of course you can pray with me. I didn't know who Jesus was. I didn't know anything about prayer. And she prayed with me, and I walked out of hospital 4 weeks later, and that's how I met Jesus. That's how I have a faith, and that is my start of my story really. And I think for me, the difficulty of my story in terms of physical disability and faith is that was my story that I clung on to.
Yeah. And
so I then went around and told everybody. I didn't really, my family weren't Christian, so I didn't go to church, but I told everybody, oh, I went to hospital, I had surgery, I met Jesus, I'm healed, I'm fine. And that was that. And then when I turned 18, I was at medical school in New Zealand. So my family then moved to New Zealand. And my aorta dissected. Now your aorta is your main artery coming out of your heart, takes all your blood away from your heart. Now, if your aorta dissects, you have about 25 minutes to get into surgery.
If you're lucky, 25 minutes.
Before it kills you. And that's 25 minutes from when it dissects to being in the operating theatre and being on bypass. So that's it's a big emergency.
We can say it's a medical emergency.
It's a bigger medical emergency. So for me, I couldn't understand how somebody who had been healed had then had something else. Had something else. And it was later that I found out, fast forward 10 years, I had lots more surgery. I moved back to the UK. It was later that I found out that I'd been diagnosed with a different condition, which is a connective tissue disorder. And my connective tissue disorder is called Loeys-Dietz syndrome, which is very similar to a condition called Marfan syndrome, which is basically, it means that the glue that holds you together, your connective tissue, my glue doesn't work as glue. So my glue is really stretchy. So anything that should be holding you together. So any joints that should hold you together,
Relax.
anything that should be nice and tight is super lax, is super elastic in my body. So that artery wall that should have been super tight was very elastic and elasticized. It got bigger and bigger and bigger as I got more and more stressed, and then it went pop. And so it's good to learn 10 years later, okay, this is the condition that I've got. These are this is the mutation that I was born with.
Yeah.
So this is a mutation that I had when I was born. I've always had this mutation. This mutation is in my body, and it's in my genetics. And this is the mutation. This is what causes these physical manifestations in my body.
Yeah.
And there's lots of different physical manifestations that it causes. So it causes different issues with my spinal cord. So I've had different cysts form in my spinal cord. So I've needed lots of different surgeries on my spinal cord.
I wonder if that was related to the Cordova syndrome.
Yeah, so they've now said, oh, actually, we think that might be related. That's probably what caused that in the first place. And also, so I then had like a spinal fusion surgery that didn't work, and they're saying, oh, actually, we wouldn't have done a spinal fusion surgery had we have known that you Loeys Dietz, because your bone doesn't fuse properly, and we know that. So I've now got metal in my back that's, not very fixated properly, and it's moving, but nobody wants to take it out either because that's also risky. So there's lots of different things that I live with now, because we know that, hey, I have this mutation, but it also means that, hey, I've got the best specialists in the world looking after me now. They're in Oxford. They are absolutely brilliant.
That's good news.
They know what what medication I should be on and what medication I shouldn't be on, and it enables me to live life with a physical disability. So that's my life with a physical disability at the moment.
You're awesome. I just feel that's why I put my hands up. I just realized to bring the tissues. So if we cry here, we have to just cry and just manage.
Don't worry.
So I'll let you know, Kate. I'm a crier. So if I cry, it's not because of you, it's just because I'm an emotional person.
It's okay, I cry too.
I'm a crier, man. So thank you for being so open and honest.
Yeah.
I think it's my turn. So living life with a physical disability for me. So for me, I had a similar trajectory to you in the sense that I lived the majority of my life so far without any physical challenges. So actually, I used to play basketball. I used to run a lot. I've run marathons. I was very physically fit when I was younger. And I grew up actually in South London. And in London, I had a lot of friends that were in gangs. And the thing that was my saving grace, I think, was that I was really book smart. So I could read something, remember it, and that got me through from place to place. And people used to see that in me, especially teachers. But like, why are you messing around? You're pretty good at this. And that helped me. So long story short, I ended up at medical school like you. And I went to medical school in London. You went to New Zealand. And at medical school, I met my childhood sweetheart. And we got married in medical school. And at this point, I've got no physical problems. But I was caring for my mum who had physical problems. I didn't really understand them too much. But as I went through medical school, I started to understand them more. And I never actually realized that I thought that this could come to me. Even though she had difficulties with walking, you
described
it so well, running like a penguin.
Yeah.
She used to run like a penguin so much when I was younger. And I never used to really think, oh yeah, this might be my plight later in life, but it was. So anyway, I finished medical school, and I then went on to start working as a junior doctor up in the Midlands in England. And when I started working as a junior doctor, with all of the stress and everything that's happening, and lots of brave people dying here and there, I really suffered, mentally especially, and mentally led to physical suffering. And I was really neglecting myself a lot. And that's when I started getting symptoms of my condition. So I started tripping on things and really struggling to see in the dark, and not knowing where my limbs were. And for me, this is weird because, like I told you, I was a basketball player. And, like, you know, I used to run a lot. And, you know, I never used to really think about where my left leg would go. It just happened involuntarily. It was a reflex. So, and you know, I'm a young black man, and I'm very self-confident. So when I trip on something, I'll be embarrassed, and it would really, really, really hurt me. So I think, so I live in a weird place, very weird place at the moment. So you've explained your trajectory very well, but for me, I live in a place of, I think I know what's going on in terms of my own body, but I haven't got a specialist diagnosis yet. Everyone's trying to put everything together, the history, the investigations, everything. I'm being seen by doctors in Cambridge, and we're trying to put everything together and trying to work things out. But it's a bit difficult at the moment. So I'm sort of in a place where, when you were describe when you were 10, where you were sort of not really knowing why this was happening to you. That's where I am right now.
Yeah.
So I'm in, what's the word for it? There's a really good word for it. Ambiguity.
Yeah.
That's where I am right now.
Yeah.
So everything about my life is ambiguous. But in terms of my physical disability, you know, now I struggle to walk a bit. I get very tired. So, and my proprioception is just knowing where your limbs are, and being able to like work out where things are. Not trip over things. Give people a high five. I struggle with those things sometimes. And it's weird because, like, that was never me, but now it is. And, like, one thing I'm learning, we spoke about this a bit before, didn't we?
Yeah.
One thing I'm learning is that in my frailty, there is treasure. There is good stuff. Because now, like, I get to sit with DK.
Yeah.
And, like, talk about being family and, like, dealing with our frailties together and managing that together. And I don't think if I didn't have these problems, I would be doing this.
Yeah.
So I'm grateful for that, but it still is hard.
Yeah.
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 Can I ask you something?
Yeah, go for it.
Okay. I want to ask you, it's a personal question, so don't
Yeah.
feel like you need to answer. I wanted to ask you, how did it feel to have this emergency, and you thought that life was going okay
Yeah.
for you?
So I think, like I said, so I'd started medical school and I
Yeah.
thought, hey, yeah, life's going to go really well. I really wanted to be a paediatrician. I've
Yeah.
always wanted to work
children.
with children. I know that that's what God put on my heart, was to
Yeah.
work with children,
Yeah.
which is fantastic.
Yeah.
Now I'm a speech and language therapist and I work with children in a very
Yeah.
different role.
Yeah.
But, you know, I didn't know that at the time, you know. So at the time I was thinking, you know, this is ruining my life.
Yeah.
It's absolutely ruining my life. Like I'm having to stay in hospital. And actually it's quite funny because I only had to stay in hospital with my open heart surgery. I only stayed in hospital for 7 days. And so I came out of hospital. I went straight back to uni. I wasn't allowed to carry on at medical school because of obviously the severity. So I transferred to like a public health non-medical course, which we call health sciences in New Zealand. But I went straight back. I emailed my lecturers and said, hey, I want to come straight back. So I went straight back to uni. My lung then collapsed a few days later because I pushed it too hard.
Your lung collapse?
Which is again a symptom of my condition. But obviously we didn't know I had that condition at the time. So I was confused of why my lung was collapsed and angry that my lung had collapsed because everybody had said, oh, you've just pushed it too much. And I'm like saying, well, they said I could go back. So I'm very, I've also got some neurodiversity. So I'm very black and white in my thinking. So if somebody says to me, you can go back to work now, I take them literally and I go back to work. I don't think they meant I could go back to university and literally go back to walking up and down hills. I think they thought I was going to start some, online lectures from my bed. But they weren't explicit enough for my black and white thinking. So, but anyway, so I had to go back to hospital with my collapsed lung. There was some issues with my healing. Again, that's part of my condition.
Part of it as well.
But we didn't know that, so we were confused of why I had issues with my healing. And then maybe 6 months later, I became hemiplegic, which is where half of my body stopped working. So somebody said to me at university, Kira, can you throw me the pen? And I went, yeah. Went to turn around to get it and realised I couldn't move my
left or right.
I think
side?
It was my
right side.
Yeah, so I couldn't move my right arm, and I panicked because I thought I can't move, and then I thought, well, I can move because I could see my left hand moving. And I thought I can't move, and again I went into hospital. They thought I had what they call medical student syndrome. Where I'd self-diagnosed.
Medical student syndrome.
Where I'd self-diagnosed myself, where I had depression. And then it wasn't until I saw a neurosurgeon who was at the top of his game, who did like a pinprick test with a safety pin. And he pinpricked me all the way up my spine, apparently, until I got to a certain level of my back. I remember it very clearly, and I went, ow, what are you doing? And when I got home, I realised he'd scratched my whole back, and I hadn't felt it, obviously. And so I got these scratch marks all up my back. I almost punched him when he got to the top of my back because I thought, that really hurts. What are you doing? He'd actually scratched my whole back. You've been doing that for the whole, even just feeling it. And I just didn't feel it. And really? He said, we need to operate. We need to operate quite quickly. And so that's when they then operated, but unfortunately that surgery went wrong, and I then had 9 correction surgeries. So that for me, when life was going really well, I was obviously at medical school. None of my friends knew I had any like physical disabilities. Because I didn't tell them that I'd had spinal surgery when I was younger. Like, nobody really knew. I mean, they kind of knew that. So when I was at like high school, sometimes I'd faint, but that was just because I was, very skinny, and I didn't eat very well. So we would just say, sometimes, that's disordered eating. That's what they would say. That's her disordered eating, or that's her low sugar levels. And so in PE and things, I'd always be like the slowest runner and things like that. Which obviously now we know is more neuromuscular. Isn't it? But obviously, again, at the time, I didn't really know that was neuromuscular. I just thought that I ran like a penguin, But none of my friends knew that anything. So when I had to have open heart surgery and then spinal surgery, all of my friends were really shocked because they were like, "Wow, like what's happened?" So
Wow, this is interesting, man. Okay, this is like a lot, and we're gonna get to the incurable boost to the end, but I think it's really good that we can speak together and just be honest. And I realized that even in you knowing a bit more, there's still some ambiguity
Yeah.
in like learning how much your body can do. And like we're gonna talk about this a bit more, but let's do it now. I wonder, like, do you feel like, how do you hold this tension between being realistic as to what you can do and believing that you can do more?
Yeah.
Is that difficult for you? How do you manage that?
Yeah, that's a really good question. I think like when I was in New Zealand, for instance, so I moved back from New Zealand in 2014 back to England. And I moved back because I spent from 2011 to 2014 as an inpatient, basically.
Yeah, basically you were in the hospital.
In hospital, all of the time, just having surgery after surgery. I'd go from hospital to like a rehab centre where they'd help me to walk and things, and then I'd go back to hospital and have more surgery, and I just didn't really have any quality of life. So I came back to the UK and sort out these doctors and sort out this diagnosis, which really changed my life in terms of, hey, what can I do? How, I can live a life. And I thought, no, I can go out and live life. And so I went back to university and did my master's in speech and language therapy. And I thought, right, I can go and work. But there is still a big tension in my body, between my body and my mind. My mind says I want to go at 100 miles an hour. And like I said, I am neurodiverse, so I want to live at 100 miles an hour all of the time. I want to do 101 things, but my body says no.
Yeah, that's so like me. Yeah.
So I'll just give an example. So at the moment, some things that I do, I volunteer at Kids Church, so I do the 2-year-old room. I'm one-to-one with special needs children. I do Wednesday nights at our Bible study for children. I do Friday nights with our youth group. I'm a trustee of a charity in Morocco who does preschool education to rural areas in Morocco. I'm doing a PhD full time. I work part time as a speech and language therapist, and so I'm busy. I run the Alpha course on a Monday evening. 12 weeks a year times 2, so we do it twice a year, which I love, and that's for people to come and find out what the Christian faith is about. And that's, I'm very passionate about that. So I do all of these things and I love it, and whilst also trying to uphold a social life and see family and friends when I can, and travel back to New Zealand to see my parents when I can fit that in as well. But I get to my alarm clock at 8 o'clock in the morning and I think, no, I can't get out of bed today. Or I get to 6 o'clock at night or 7 o'clock at night when other people maybe just having dinner, and I'm at the end of some of our kids' church finishes at 8 o'clock or quarter to 8. I go home at 8 o'clock and I go to bed. And that's me. I'm done. That's I'm out. And some days there's probably one day in the week where I need to spend in bed. I just can't. Some days I can't even get out of bed. I've spent everything. I'm just in bed. So I think there's a real tension still between how much I can do, and I've been on so many courses on pace yourself, and it's all good in theory, but actually in life I find it really tricky to do, because I still want to do everything that my mind wants to do, and that my heart wants to do, but my body just says no. What about you?
For me, I mean, like, I'm not gonna lie to you. I teeter more towards the end of try it and fail.
Yeah.
And that is not always a good thing, especially when you got a physical disability. Because you and I were talking about the spoon theory,
Yeah.
and how this is different for somebody with a physical disability.
Yeah.
Because it makes normal everyday tasks, relative tasks, harder and more arduous and tiring. And actually, they take up more of you. And it's realizing that actually sometimes it's okay to say no. So, in answer to your question, I'm not doing it very well. The tension is there, and I'm struggling. And I think what I find hard is similar, very similar to you, is that my mind is like, first do this thing, do this, do that, do this, and I want to do it.
Yeah.
My body's like, sir, excuse me, sir. No, you need to go and sit down.
Yeah.
Go and relax. And yeah, I do struggle with that. For me personally as well, let's be honest. So as well for me, I know not everyone shares this, but for me, a big deal is prayer. So like because I have a relationship with God, I ask God for help when I need it.
Yeah.
And I think God actually does more. I think God helps me when I don't realize I need it.
Yeah.
I'm doing things in the background till it's
Yeah.
like, oh, what? I didn't realize I needed help there. And he's
Yeah.
got an angel looking after me in some way. And I believe that. I believe that God does that kind of stuff. And maybe because of my parents now, because there are times that, like, for example, you said hello to my daughter today. Just to make sure that she has good morning. There are things that I've done in the background that she will never know about.
Yeah.
Like, I move the toys up the stairs, or I make her breakfast before she wakes up. These things, she doesn't realize that I'm doing it. But I do it because, like, I know it will bless her.
Yeah.
I think it's a very similar thing with God. Like, God helps us in our time of need, yes. But actually, God also helps us when we don't realize that we need Him. I personally think. So, am I answering your question?
Yes.
Yes, I am. I'm saying that I'm struggling with this. There's a tension there. And I'm much more inclined to sometimes just do more than I actually can do. But when I need help, I ask God for help. And sometimes when I don't realize that I need help, I believe I'm being helped anyway.
Yeah.
So that's my answer to that. So I think if people can be encouraged by our stories today, I hope that people start to pray.
Yeah.
Call in the name of the Lord. And like, I think as well, okay, yeah, prayer is good, but as well, I think doing what you and I are doing today, like we were joking earlier, we're like, oh yeah, you're a lovely white lady, I'm a lovely black man, and we're different.
Yeah.
But we have so many similarities, and we didn't realize this, and I believe that God brought us together so that we can encourage each other. Because there are times that you're okay, I'm sure. I don't know, but I'm pretty sure. There are times in your life, forget this. I'm tired of this.
Yeah.
And I can be like, no, keep going, Kate.
Yeah.
You can do it.
Yeah. Yeah.
And there are times that I'm like, forget this.
Yeah.
I don't want to, like, an EK in my ear. Like, no, Chris, come on, you can do it. Keep going.
Yeah.
And like, even we were making jokes the other day about Nova. She was, I think she was crying or something in the class, wasn't she? She was very upset. And I was tired and I was just like, I can't deal with this. And like, you just help me think about her, put myself in her shoes, and we started talking about attachment theory and all these things, and I was like, you know what, let me empathize here, let me try and think from her point of view how this feels for her. And that really helped me in that moment. And I know obviously it's not like that for every moment in life.
Yeah.
But sometimes it is. And I think that's the beauty of being in relationship with each other.
Yeah.
And helping each other, is that sometimes, that's what Mom used to say, sometimes you can't see the whole picture when you're in frame. And sometimes you need someone to be outside of your picture to help you have situational awareness.
Yeah.
Work out what's going on in life. I have a perspective that is a bit bigger than your own perspective, your own life.
Yeah,
But
definitely.
yeah, that's what I think.
Oh, really, really good. I think as well, going back to the you know, the tension between doing, you know, more than what I can handle. I've learned different tricks along the way.
Yeah,
you know,
coping strategies.
Coping strategies. So prayer is obviously a really big part of my life, and you can hear that in terms of even. And I go to kids' church Bible study on a Wednesday and youth church on a Friday, but I do simple things now that reduce the amount of physical load on myself, so I can then do those things. So for instance, I have a cleaner.
Good.
And I used to, the idea of having a cleaner in my house repulsed me, absolutely repulsed me, because I was like, I can clean, I'm good at cleaning. And actually, the fact of having a cleaner come into my house, I'd be like, they've not cleaned properly.
Yeah.
But now I'm like, Kira, I can't actually clean properly because I can't use my arms properly enough to do it anyway.
Yeah.
It takes so much of my energy to do it. It's not that much money to get a cleaner to come in. And actually, it's more about the humility of saying, hey, I need some help.
This is controversial, but this is good, you know. Carry on.
So I have a cleaner. And I think, hey, cleaners save marriages. Just saying. Cleaners are fantastic. I think, anyway, so I've got a cleaner. I get my hair washed. So washing my hair is a really difficult task for me because I've got, again, those of you who can't see me, I've got a lot of hair. I've got a mob of ginger
She does have a lot of hair.
I've got a mob of ginger hair. It's very thick and long. And it takes,
so almost as long as mine.
it takes a lot to wash it and a lot to dry it. So now I go to a salon and get my hair washed once every 2 weeks. It only needs to be washed once every 2 weeks, which I'm very fortunate about. So I get my hair washed, so I don't have to wash my hair at home. So it's things like that that I've taken off of my to-do list that now I've given to other people, that I'm like, right, they're tasks that would be simple tasks for an able-bodied person. But for me, they actually, if I was to wash my hair, that would be the only thing I'd be able to do all day. And actually, instead of that being a task for an all-day task, I can do so much other things in my day. With other people. And I can just go and get my hair washed and it takes an hour.
I think you've hit something, you know, that is very common. So, I speak to a lot of dads who just had their firstborn, or they are twins or triplets. And like, one thing they seem to all be saying is that when you have a baby, it is like inheriting a physical disability. You're more tired. You have got less time to look after yourself, to do things that you want to do. You're emotionally quite stopped up and difficult to release. So like, I know it's not the same, and I know you and I have difficulties that are different. But I think there is a parallel, a synonymous thing here, a common thing, a common theme. That's what I'm trying to say. A common theme here, whereby people with children, young children especially, or pregnant partners, may need to actually do what you're saying, you know, decrease the physical loads. Obviously, you use the example of cleaner and hair wash, but there might be something in that, and like, okay, let's just be honest. Oh, I don't like doing this, but let's be honest. I think it comes down to pride. It does. I don't want no one to see. I don't want no one seeing my house. I can do it myself. And really, in order to prioritize yourself and the family, a lot of the time, you need to actually suck up your own pride. Like, how can I decrease my physical load here? And I'm saying this, I'm preaching to the choir, by the way.
Yeah.
I'm saying this because I'm so bad at it.
Yeah.
My pride, maybe it's a Nigerian thing, but my pride is strong.
Yeah.
I'm just like, no, I don't want to do this. And actually, I think sometimes, what did you say? Taking the humility, the humble approach is the way forward for not just with physical disability, but having families. Sometimes sucking up that pride. It's going to look different, detailing it for each person. Some people need to get a cleaner. Some people may need to get a cab instead of driving there.
Yeah.
Some people may need to prioritize breakfast.
Yeah.
Some people may need to actually fast.
Yeah.
You know, it's going to look different for each person, but I think there's something in that, you know?
Yeah, definitely.
Coming from that place of humility. I feel like we should go into question 2 as we're going to talk about that. Should we go into question 2?
That sounds good.
So question 2 is all about, okay, so we're talking about physical disability now, but what would you want other people to know about physical disability? The floor is open. I can go first if you'd like me to, or you can go first. It's entirely up to you.
You take this one.
Alright. So what would I like the world to know about physical disability? So I'm going to say this, and please correct me if I'm wrong, because like I know everyone's disability is different, and I know everyone's life is different. But one thing I really struggle with as a person, and I wish other people would know this, is like, it's a very weird thing, because I think most of the time it comes from a very good place. People are just trying to help and be helpful. But sometimes I don't want to be helped.
Yeah.
Does that make sense?
I'm with you.
You're with me. Okay.
I'm with you.
Sometimes I'm like, actually, don't want to struggle, but I don't want to be helped here. I actually want to try and do things myself. And that is a big part of, that's what, that's a big part of my cognitive load with this physical disability. That I'm like, how are other people going to perceive my life?
Yeah.
Are they always going to try and help me with this?
Mm-hmm.
And sometimes you need these help, and actually it comes back to my pride and humility. Sometimes I need help to walk down that slope, or to see that thing, or to write in our books, whatever it may be. But yeah, that's what I'd want people to know. Ask before you help.
Yeah.
To me, that's my thing.
I think I respond to people when they ask me if I need help. My response now is, don't worry, I'll ask if I need help.
Really?
Yeah, that's what I say to people. Because I think, you know, again, like you say, they're doing it out of good gesture, but I also think like it's good for them to know, hey, I'm going to ask if I need help, because then it might stop them from asking someone else.
Good point.
Because actually, like, you know, for instance, like I've fallen over before and people have asked me if I need help up, or actually sometimes people have gone to help me up, but actually going to help me get up when I've fallen over is actually makes it more difficult for me to get up, because I get up in a really, I've been taught how to get up when I fall over. So I get up in a really certain way. So if I'm then crowded by people, or people start pulling limbs, well, my limbs dislocate really easily, so things start popping out, and then people get scared because they hear things going pop pop, and I'm please don't pull my shoulders, and you know, and it's like, just if you just leave me for 2 seconds, I'll get up, I'll be okay, you know. So it is that thing of like, just wait, and I'll let you know. And so I always say, even to my friends and family, I always say, you know, if I collapse when I'm with you, wait for a minute, not a minute, maybe wait for a few seconds, I say, and see if I'm awake, because if I'm alert, I will get back up myself. If I'm not,
Yeah.
then please call for an ambulance or get some help.
You get some medical help. But I think this is good because I'm hoping that people watch this video and realize that actually everyone's disability is different.
Yeah.
Like for me, literally, I'm learning this about you for the first time.
Yeah.
If you fell over, that's the first thing I do. I lift you up.
Yeah.
And actually, I might be doing you more harm than good
Yeah.
doing that.
Yeah.
And this is powerful, and I think this is why it's really important to ask and find out from people before you do things. But I'm just so aware that, okay, let's talk about the other side, okay? So I'm so aware that sometimes we need help and we don't realize it.
Which is why it's always good to help, but to ask, because
Yeah.
if somebody said to me, can I help? It would make me think, wait, can they help? Do I need help getting off this floor? Like, oh, no, thank you. I'm good. I'll ask if I need help. You know, but actually sometimes it'd be like, oh, actually, I need help. I can't get up this slope.
Yeah.
I've been in situations before where I've literally been stuck and I've been like, yeah, I can't get up the slope. And you know, somebody said like, can I help you? Yes, please. Can you help me get up the slope? Or like, I've been stuck. I've not been able to get my legs around the stairs properly. I also have issues with my proprioception, so I don't know where my limbs are in space sometimes, and I just can't get them to get up the steps. And I think sometimes people watch you from afar for a while, and then they say, oh, can I help you? And I'm like, yeah, go on then. Yes, please. Can you just move my foot for me?
Asking is so important.
Yeah, but I think if you ask, then but I do think that as you grow with your disability, you learn. Again, it's that humility and that pride, isn't it? You learn more about being, or you feel. I think you feel more comfortable with asking for help as time goes on, especially from loved ones. I think. I still feel uncomfortable, I have to say. Like, if I'm going to hospital, I'd still prefer to go by myself. Whereas people always say, like, no, go with someone, get someone to take you, you know, go with. And I'm always like, oh no, I'd much rather just go by myself. Like, oh, I don't want to bother anyone. You know, I'm still very much like that. But I do think like you get better as you go along your journey. Maybe.
This is a powerful conversation, and yes, hopefully people watch this and have more patience with each other and realize that actually everyone's on a journey, and it's not just about physical disability. Like, it's also like that guy you see in the store with his baby in the pram crying and having a meltdown,
screaming,
and you want to get there and do something, but actually sometimes not doing anything or asking. It's actually just as powerful.
Yeah, it's the same with the toddler on the floor that's screaming. I used to look after a little girl called Ava Rose, and her parents won't mind me sharing. She would scream. She was a screamer, and there was a time that I was with her mum and her mum had her in her arms. She was screaming, kicking, screaming, and somebody came up to her and said, "Oh, don't worry, you just need to give her a hug, and she'll be better." And I just looked at this lady and was like, "Are you serious? She just implied that she was this young child, Ava Rose, wasn't getting any hugs from her mum, and she obviously got lots of hugs. And I felt like saying, do you want to give her a hug right now? Because all you'll get is a kick and a punch. You know, do you know what I mean? I just think, you know, and again, people are trying to be helpful. They're trying to give good advice. Whereas if you just said like, do you need any help? And then if a parent says like, no, thank you, I'm happy with my child screaming on the floor, then you go, okay, we've all been there, and carry on walking. Then they just feel like, oh, I've been seen. I don't need help, and move on. Rather than giving unsolicited advice that it's like the same with disability. When people give you unsolicited advice of, oh, have you tried these herbs? Have you tried this supplement?
Tried this tea.
This supplement. Yes, thank you. No, that does not work for my condition, but thank you very much. That diet does not work for me, but thank you for your input in my life.
Oh. And I think you're right, you know, Kate. And people are just trying to help, and they're trying to come from a place of, but hopefully they can see here, and hopefully you me speaking about this will really help people realize, actually, let me just put myself in their shoes for a second, see how that person feels.
Yeah.
And hopefully this will make stronger families. Yeah, good stuff. Question 3 is all about worries. So what worries you about having a physical disability?
I've got like a range of worries. Living with physical disabilities.
This is why we're talking.
So I think for me, I live alone, and so one of my main worries, and I think for my family, like their biggest worry is like if I collapsed at home, and somebody wasn't there, or I didn't have my phone close by, you know, something happened and I was alone. But you know, I do feel that, you know, whenever anything's ever happened to me, I've always been with people. I've always been, you know, I've never been alone, and so I just feel like that just would never happen. I just feel like God's always, you know, got me in a place where I'm with people. Even my most recent one had an anaphylactic shock, and had like an allergic reaction. So I've got part of my condition means that I've got mast cell activation syndrome, which means that I have like my mast, it means when I have an allergic reaction, my body reacts in a different way, basically. And so but I had a whole lot of friends at my house, and they knew where my EpiPen was, and they went and got my EpiPen and called an ambulance, and the ambulance came really quickly, and it all just worked out really quickly. And I think, you know, but that is a big worry that's always at the back of your mind, or
it's always at the back of your mind.
What happens if I'm driving, and you know, but then at the same time, I do want to keep driving for as long as I can, because actually that's my independence.
It's a balance, isn't it?
I think the loss of independence is the biggest worry around life. And you know, actually with a physical disability, it takes away your independence almost bit by bit. You lose bits bit by bit, and I try not to view it as losing bits of life, because I think that's like a really sad way of viewing it.
I'm not crying at you. This is sad.
But you do lose your independence bit by bit, and you do have to ask for help. You do have to ask for help more than you would if you were an able body. You do see things that you wouldn't see if you were part of an able body. Do you know, one of my favourite examples to give is, do you know, I think most disabled toilets are designed by able-bodied people. They all have push and pull, well, most of them have push and pull doors. Well, have you ever been in a wheelchair and tried to open a push and pull door? It's almost impossible. If you're by yourself and you're trying to push a door open, you can kind of do it if you've got, but you've got to have very good core muscles. I don't have good core muscles, so I almost fall out of my chair pushing it forwards, because I can't use my legs because I'm in a wheelchair. And I don't have good core muscles because I'm in a wheelchair, but never mind, we won't go there. I'm trying to push the door, but trying to then pull it back closed, I'm wheeling my chair back up. It's a nightmare. There should all be sliding doors, but we won't go there.
No, we should go.
Designed by an able-bodied person who hasn't thought that through. But I think a lot of our, you know, a lot of life, even a lot of like disability friendly things are designed by able-bodied people. And so you lose your independence bit by bit, and so it's all about clinging on to the independence that you do have and trying to keep as independent as you can. You know, and so that's a big worry, is losing that independence. And then the last worry, I suppose, is passing any genes on to future generations. You know, you were saying earlier, you know, you didn't realise that your mum, when you were looking after your mum, that could then be passed on. And my gene that I've got is a dominant mutation, so you know, it's a 50% chance of passing it on. So that's a big worry as well.
Of course.
But there's also, it's a big worry, but also there's, you know, I was a little bit offended in a way, because the doctor was saying like, oh, would you know, it's not worth you having a child because your child could end up with this condition. I'm saying, oh, you're saying my life's not worth living? So it's a bit of a battle, really.
It's a balance,
there's a bit of a balance there. So yeah, it's a really tricky one, but that is a big worry as well. What are your worries?
Oh man, I'm gonna cry here.
Oh no.
No, it's fine. But literally, that is exactly how I feel.
Yeah.
I feel like you've hit the nail on the head. I love that saying. You've literally done it. So my was a pseudo one. Independence is important. Losing independence, that is the hardest thing. Because like things that I wouldn't naturally do myself. Yeah. I'm like gotta plan it and think about little things that are like, for me it's my thing, but like journeys. Yeah. I've got to really think about my journeys, and like lots of independence. I can't just get up and go, and that is really, really difficult for me. Yeah. But I think the biggest one is actually your last one, like is, and I'll just summarize it in one word. This, for me, this is what it is. It's the uncertainty, not knowing the future, especially when it comes to like passing genes on. Yeah. And when it comes to also like, then you've heard of the term ACEs. Have you heard of ACEs? Like adverse childhood experiences. Yeah. So like I think of like, you know, we said hello to my little girl. She's awesome. She's 7 now. And I'm like, and I try not to cry here, but it's gonna be hard for me not to. But I always think about like, she's a young carer for her dad. As much as she doesn't want to be, that's her life. And that hurts me. I'm like, I don't want her to hold my hands. And even if she wants to, I don't want her to. Because I don't want her to have that burden. And that causes me so much pain. And, you know, forever, gonna cry here, we shouldn't cry. Right, that causes me a lot of pain. It does. And I think that is common, not just for us and our own disabilities, but I think everyone's got that worry in a small way. It may be a physical disability, but it may be like addiction problem. Yeah. You know, some people might really struggle with alcohol. I don't personally struggle with alcohol or drugs, but some people do. And like, some people might struggle with conflict. They can't resolve conflict, bro, or they shout a lot. Yeah. And like, they feel like, oh man, my own emotional difficulties filter onto my children. Yeah. And filter onto my families. And that can be so, so painful, Kate. Yeah. And I think that's my main worry. The uncertainty of, it's a risky business, this whole relationship life business stuff. It's risky. Because like, there are so many pros, but there are so many cons. And it's like, you wouldn't want to live your life alone, but living your life with people is risky business.
Yeah. It is risky.
It's risky business. But I feel like I'm skewed towards the end of, it's a risk, but it's a risk worth taking.
Yeah. Yeah, definitely.
Man, like, okay, So like, for some people it's not really that big of a deal, but for me it is. So this morning I tried to make Ava a hot chocolate in the morning, and I know that she likes marshmallows. I know she likes that in hot chocolate. So I was like, okay, bread and marshmallows. So I already told you I can't see bread when dark, but I can see in light. I got my phone torch out and I scanned the cupboards trying to find these marshmallows, and I found them. And I was so pleased. And I used like I've got like it's not a specialized thing, but it's specialized for me. It's a go-to strategy for me. So I've got like a teapot, but it's quite big.
Yeah.
So I can use that to pour into a mug without spilling it. And then to put leave hot chocolate. And I put the marshmallows in there, and she said it was okay. She was like, it was okay. And for her, for me, okay, it was like almost 10 out of 10. So
Brilliant.
I was very proud of myself.
Yeah.
And I was like, I'm going to do this interview, and I'm going to bless you in this way.
Yeah.
And I was pleased to be able to do that. And to be honest, I'll be honest with you, Kate, if I didn't have my own physical disabilities and my own physical problems, I don't think that would have been that big of a deal.
Yeah.
But it was to me.
Yeah, that's the thing. So I can't pour hot water at all.
Really?
So I've got it's a machine that I just press a button and it does
and
my
it's like
one.
an
It just does like a 1 cup thing at a time. It
Okay.
just boils 1 cup at a
That's
time.
quite helpful.
Yeah. Again, so it's these little things like you would come to my house and I think you wouldn't see it as like a disabled house.
Yeah.
But I can't use knives. I can't use sharp knives because I don't have my proprioception anymore.
Yeah,
so
you
I
said,
cut my finger off once.
No,
top of my finger
no more
off.
cutting your fingers off.
So-
you don't use them anymore.
I don't use them
Good.
anymore. So now there's no sharp knives in my house. So I just buy like all my veggies already chopped. You know, so everything's chopped.
Yeah.
So like my house doesn't look like disabled friendly, but if somebody like, you know, like a PIP assessor was going to come to my house and they were going to say like, oh, what do you do? Like what's
Personal independence
independent payment? Yeah. So like if they were going to say like, oh, what do you do? How do you adapt your house? Like, well, look at all these adaptations that I do. Like there's no sharp knives. There's no, I can't pour hot water. There's so many different things that, you know, that you say that you don't even realize until you look at and you go, oh yeah, actually, yeah, all these different things that your physical
This is
disability
it. And I
takes away
think
from you.
You're right, you know. I think we should actually once in a while remember these things and look at them. It's actually like, okay, let's take it out of our lives. Isn't everyone's life? Sometimes there's this thing. Yeah, they used to do it back in the Bible actually. They used to pile up a pile of stones. Like Joshua used to do it, Moses used to do it. Pile up stones and remind ourselves, you know, this is where like you had this battle, a testimony happened.
Yeah.
This is where you had this test and it turned into a testimony. And sometimes you're looking at like something as simple as not having sharp knives in your house. Reminds you that actually back in the day I cut my finger off.
Yeah.
But actually now I've made this adaptation.
Yeah.
I don't need to do that anymore. And actually my house is safer for me.
Yeah.
And actually I think that sometimes there's something about, I always try to encourage the listeners, there's something about taking time, look back, look at your life, see where you come. And that, like, okay, let's be honest, like in our generation now, we are getting so, like, it's so easy to become discouraged and defeated and just feel like, what's the point?
Yeah.
Like, even when, like, it's very sad, even when you're talking about, kids and stuff, and like, it's sad, like, you feel like, oh, is my life not worth living?
Yeah.
And like, that's not only UK,
No.
this is a lot of people. Like, I recently read this thing, what's it called? Lost Boys Report. It's a report about young men in the UK and how the suicide rates are increasing so much.
Yeah.
People feel so purposeless, not just, and we're talking about young men, but like people in general, girls as well, feel so purposeless.
Yeah.
And because of that, forget this.
Yeah.
And I think that one of the solutions is actually once in a while listening to this stuff and looking back and be like, why do I actually do what I do, and what have I actually done in my own life in order to manage my life better? Why is my life worth living? Yeah, so I've been encouraged by that. Number 4 is all about encouragement. So how do we find encouragement in having or managing a physical disability?
I think there's like lots of different ways. But for me, like my top ways, I haven't pre-prepared this, by the way. This is me thinking on the spot.
Fresh off the dome.
For me, one of the most encouraging things to do is to share your story. So to share, even just sharing my story with you and listening to your story actually encourages me so much, because it can feel quite lonely having a physical disability sometimes, but also sometimes I shared, obviously, like I have Christian faith. I've got a physical disability, and I believe in Jesus, you know, and sometimes that can feel conflicting, but it can make you feel very lonely, because again, some very good-willed, good-intentioned people can say some very apathetic is the only word I can use there, or comments like, oh, but your illness is not good, it's not of God, so if you just pray, it will go away. We've tried that, don't worry, everybody listening, we have tried, we have prayed for healing. And what I can say, just on the subject of healing, just while we're here, is that I have prayed for healing with a number of people over the years, and I have seen some people be miraculously healed. And I know that our God is a good God. He is a God that can miraculously heal. And he will do that if it's for his glory. But he has already healed everybody, and that our physical manifestations will be healed when we get to heaven, and whether or not they are healed when we're on earth is for his glory or not his glory. And my prayer is for him to use whatever I go through for the good while I'm here. And you know, I've met so many people, I've shared my story with people, I've prayed for people in hospital. I've prayed for people just before they've died when I've been in hospital. I've been in positions that I've not been able to be in. You know, I look at what my physical disability, what my illness has brought me, what the positives it brings me, the empathy that it has taught me, that I wouldn't have had if I didn't have this, the experiences that it has brought me that I wouldn't have if I didn't have this, the adverse childhood experiences that I wouldn't have if I didn't have this. But actually those things are formative. They've made me who I am, and actually God can use those for the good, because God uses everything for the good for those who love him. And that's just my prayer, is that he continues to use everything for the good. He didn't give us these physical disabilities. He doesn't give people bad things. You know, these illnesses are part of the fallen world that we live in, but he can use them for good. And I've seen him use them for good. So yeah, my encouragement is to keep sharing, to keep praying for each other, and to look at the good things that illness can bring you, because actually it does bring good things as well. And it's focusing on those in those rough times, because there are rough times. It's focusing on those small things, because sometimes you've just got to focus on the really little things to get you through each day. It's like okay, right, today's not a big picture day. Today's just what can I tick off my little list?
Yeah.
And that's okay. And being okay with that, being okay with today's I'm going to sit in bed day. And it's okay that today all I did was lie in bed and rest, because actually rest is on my to-do list.
Yeah.
So yeah, that's me.
Putting rest on the to-do list.
Putting rest on the to-do list.
Wow.
Is
putting rest on the to-do list. I feel like that is everything.
Yeah.
That's
It's needed.
everything. Wow.
Honestly, how about you? What's your?
So I just forgot me. I want to say, you basically being faithful in your frailty.
Yeah.
Is so important, regardless of this physical disability. Is a spectrum.
Yeah.
You know, it's different for each person.
Yeah.
And actually, depending on the position of life you're in, it's different. Like, relatively, compared to Usain Bolt, even when I was running, I was probably physically disabled.
Yeah.
So it's relative. All of it's relative. Like, compared to, like, Michael Jordan,
Yeah.
I'm very, very short. So, like, you know, everyone's got a relative thing. But it's all about being faithful in our frailty. And I think you've said it perfectly there.
Yeah.
And putting the rest on this to-do list, I'm going to take that.
Yeah.
But now let's talk about me. How do I find encouragement? Oh, so literally, this is it. What you said is so key. Sharing your story. But because I've got to, I'm going to do it. I'll throw a span in the works. I think sometimes we have to be a bit guarded on who we share our story with. The reason why I say this, because like I think we're all trying, but we're learning to understand better.
Mm-hmm.
And I think sometimes like some people aren't safe with your story. And actually, and it's quite negative, but it doesn't always have to be positive. It's being honest. I think sometimes we have to just be aware that, you know, not everyone is, it's a weird thing to say, but not everyone has a good grounding to your story all the time. Mm-hmm. And that's hard to discern. That's the word for discern. Mm. But I believe that discernment is something that comes with age and more wisdom, but also something that is given by God as a gift. Learning how to discern who you share your story with, but sharing your story is so important and so powerful. Yeah. And actually, this is not even like not current. This is very current. Like even, I don't know if you've heard of it, but if you heard of this therapy thing called BetterHelp.
Yeah.
So it's like an online therapy thing that is like, you can basically choose your therapist. You try out therapists, and then you choose the one that you best affiliate with. And like, I think like I often listen to different podcasts, and they were saying like over 4 million people use BetterHelp now. And I think that's really powerful. I think it's realizing actually not everyone is your therapist. Yeah. And sometimes you need to realize who is appropriate to hear the story or be with you in this time. And that's hard to do because you don't want to be islands, siloed, but as well you want to be open. And it's a balance to strike. But I've spoken about Europe. I think that's me. I was thinking about what you're saying.
Yeah.
But in terms of encouragement for me, so this is like, it's a challenging one, we'll say anyway, okay? So I believe that you need to stay hopeful. Mm. And I think the way to stay hopeful is always hoping for a better. Now, better might be removing the sharp knives. Better might be having that thing that pours hot water for you without you burning yourself.
Mm-hmm.
That might be better for you in this time and age.
Yeah.
But I believe, and I think you believe as well.
Mm-hmm.
I believe one day there'll be no more crying,
Mm-hmm.
no more dying, no more death, no more disease.
Mm-hmm.
And I believe one day that Jesus that we talk about is going to come back, and there's going to be a beautiful new heaven and new earth. And for me, I believe that I'm going to be reunited with those that I miss dearly.
Yeah.
So I try not to cry again. But like my dad, my mum, my daughter, second daughter, my brother. I believe that I'm going to be reunited with these people because Jesus' finished work on the cross.
Yeah.
And I believe because I have that hope, I can live now.
Yeah.
I can do this stuff now. I can be encouraged now.
Yeah.
In this frailty.
Yeah.
And that hope for the future encourages me now in my disability. Now, this is going to rock some theological waters, so be willing. You can disagree if you want. This is an open dialogue. Disagree if you want to. So I believe that we need to not lose hope. What I mean by that is that it's what I think. I think that you should still believe that you can be healed in this land that we live in.
Yeah, no, 100%.
And I believe that if your left leg is causing jip in this land of the living,
Yeah.
I believe that you should still believe that God can heal that left leg.
100%.
And I found it difficult to do this because at first, when I first started struggling with my disability, I was like, Helen, high water, that's it. It's done. Just live your life, get more frail as time goes on, and just like try your best, but just don't hope.
No.
Like the new heavens and new earth are coming, that's what you can hope for. But I believe there's stuff to hope for now.
Yeah.
Like I can because I've got a sense of like hope and belief, I can make my daughter the hot chocolate.
Yeah.
And I think if I didn't have that sense of knowing, being realistic, like I know that I struggle with certain things.
Yeah.
So I've got to be sensible how I do it. But as well, having, for that better word, faith. I don't think I can live this life.
No, me neither. Someone said to me, how have you got through everything you've got through and you still believe? And I said,
Yeah.
wait, if I didn't have my faith, I wouldn't have got through everything I got
so
through.
see.
I wouldn't still be here. I definitely wouldn't still be here. I think without hope, without hope, literally without hope, without faith, there'd be no way I'd still be living. Because
this is it.
why would you still want to live? Why would you still want to still be on earth if you didn't have a hope for a better tomorrow?
This is it.
And so I do, and when I was saying before, you know, God, I do believe that God can heal you physically of your physical manifestations. I've seen it. I've seen him physically, you know, heal physical manifestations on earth.
Yeah.
And I do believe that he can, but I believe it's for his glory. And so I believe when he does it, it's for his glory. And I think that the peace that comes from that, when I accepted that, when I accepted the fact that, hey, he will heal me of all my physical manifestations for his glory in his time, the peace that came from that changed my life. Because I thought at that point, I'm not angry with him anymore. I'm not angry with the fact that I'm living with a condition that I'm not healed from.
Yeah.
Because actually I'm peaceful knowing that, hey, it's for his glory. In his time, it's for his glory. Hey, God, use me while I'm here.
Yeah.
And so that's, do you get what I mean? And so it's that piece of, hey, I know that you're going to, I know that this is a thing, but I'm now peaceful. I've now been, my heart has been healed.
Yeah.
My mind has been healed. And
It's the peace that passes all understanding
Yeah.
that the good book is talking about.
yeah,
This is it. But I want to say something, and I wonder what you think about this.
Yeah.
I believe chronic illness,
mm-hmm,
like, it is a perfect storm
mm-hmm,
for discouragement.
yeah,
And, like, after, I just feel like if you keep going with somebody, like, nobody wakes up in your body like you do.
yeah,
Nobody wakes up in my body like I do, and
Yeah.
it can be very discouraging. You're like,
Yeah.
you're working so hard to do this thing, and
Yeah.
then it doesn't come as easy as it seems to come for other people.
yeah,
And that can be discouraging, let's be honest. And, like, I think that can lend itself to hopelessness.
yeah.
How do we fight against that?
I've learned not to compare.
Not to compare.
Not to compare. Comparison is the thief of joy. Like,
This is it.
I've literally learned not to compare. I don't compare myself to anybody because actually we have no idea about the life that anybody else lives, and something that might look like it comes easy to somebody might not actually. You know, on the outside, I look relatively well. It's actually quite funny because I think I look a lot more physically well than I actually do, because I have a disabled badge and I park in the disabled bay, and 90% of the time I park with no issues. But I say to my friends, like, oh, I'm embarrassed because if, like, people see me, they might think that I shouldn't be parking here. And my friend said to me, like, my best friend said to me, no, they'll just see you walk and they'll be fine. And I'm like, what do you mean? Did I not walk normally? And she's like, no, they'll know as soon as you walk. I'm like, oh, okay, all right. Okay, I thought I walked normally, but no worries, all good. And so it's those things again, I'm like, I just forget that I don't walk normally. But it's those things, like, actually, from the outside, you know, when I'm standing with your 2-year-olds on a Sunday morning and I'm carrying your 2-year-old, sometimes I've got 1 2-year-old in each hip. I might not look like I actually have a physical disability because my Discovery Kids top covers my heart scar and my spinal scar very well.
Yeah.
You know, I may not look like when I'm on the floor with the kids that I've got a physical disability, you know, because I'm not walking. You can't see me walking at that point. And so you may think, like, oh, she's got her life all together. She's doing a PhD. Everything comes easy to her. And actually, behind the scenes is a very different life story. So I just think, yeah, if we don't compare our lives, then, you know, which is very difficult to do, obviously, because we're humans, and it's our natural instinct to compare. And I think especially with social media now, you know, especially young people, that's what they do. They sit on social media and scroll and scroll and scroll and compare their lives to, you know, things that are not even real. You know, they're fake pictures posted online. But I now take everything with a pinch of salt and just say, you know, they're not real pictures even, you know. You can post a picture very, very happily and and it not be the real life. So I just think
avoiding comparison.
that's a way to stay encouraged, or a way to stay not discouraged, is to not compare, because actually lives are not what they seem.
Yeah, you're so right. And actually, you've hit the concept of the invisible wheelchair that we're talking about. So many people are wheelchair bound. Everyone is wheelchair bound, but may not have physical wheelchair that you can see.
Yeah.
Like, for them, it might be anxiety, it might be depression, it might be a struggle. Let me not box it. It might be a struggle with their mental health. It might be social things, like you said it before, the neurodiversity, the black and white thinking. It might be difficulties with that. It might be a fear, a constant fear. Actually, you and I are different because you and I, we know the Lord. But actually, I was thinking about it the other day. Many people live in a place where they actually have no peace with God. it's a constant fear,
Mm-hmm.
not reverence, not the mass fear, the actual scared of God
Mm-hmm.
consistently, like, and living with that in itself is like having an invisible wheelchair.
Yeah.
And I think you're right. I think the way to really combat that discouragement and be encouraged is really not compare. Be honest with yourself.
Yeah.
Be real. Like, that's what we used to say in Southampton. Be real, man. Don't be fake. Be
Yeah.
real. And I think you're right there.
Yeah.
But hey, we're gonna cry here and be sad. But it's true though, we've had a really good conversation.
Yeah.
Is there anything else that you'd like to say to the people that are listening as we close now?
No, that's good.
Yeah, me too. I think that was good. I'm gonna give you a high five with my awkward proprioception.
We got there.
So yeah, thank you so much for joining us for another episode of 40 Weeks Men, Soulful Families, and we learn together, and hopefully you'll be watching this space for much, much more.